We are so excited to be joined today by Dr. Sarah Oreck, founder of Mavida Health. We are excited to chat with you today about your work as a reproductive psychiatrist and how it relates to infertility and IVF journeys and the mental health side of things. And so we'd love to just start by opening the floor. And if you could tell our listeners a little bit about the work that you do and also about Mavida.
Fantastic. Yes, I am a reproductive psychiatrist by training. So that means that I really trained in how female reproductive hormones impact mental health in all these different ways. And as a general psychiatry resident, I was able to see how some of the best psychiatrists in the world have no idea what to do when they encounter someone who's pregnant or postpartum or in perimenopause. So really
Mm.
dedicated my career to this, was in private practice for a long time, working with some big health systems, but ultimately was finding that people couldn't get this specialized care. There's very few of me. And people wanted this care that was in network and accessible and affordable. And so that's when I launched Mavida Health about 2.5 years ago to really help with this mission of getting this across the US affordably and accessibly.
That's amazing. Yeah, I think both Amy and I have been through extensive infertility journeys where we've both gone through IVF. I have a 6-month-old daughter who was conceived using IVF. And so have also experienced the postpartum side of things with
Yes.
mental health. Yes, which is, I know, a lot of what you do. Um, I think for our listeners, what one of the things that we're really curious about, we're finding like a lot of our community is wrestling with the not being pregnant or the how do I gear up for another year of fertility treatments and continuing to try. And so we'd love to just hear from you, speaking to a little bit about like what you see with patients and with people as they are trying to conceive and some of the things that they can put into practice to maybe help with some of those mental health challenges.
It's really difficult. I also had my third child via IVF and have had personal experience in late loss and what
Mhm.
during the holidays and how
Oh.
complicated that can be, especially when you're getting all of these beautiful Christmas cards or holiday cards with like babies everywhere and young children. And I think it's important, both from the perspective of someone who's going through it, but also if you're not and you're listening how to be supportive. It's like just thoughtfulness around all of those things. Even,
Yeah.
the matching pajamas, all of that thing. Just be
Mm.
aware of course,
Yeah.
celebrate with your family. Just be aware how that may impact someone who's struggling or having a hard time building or growing their family. But certainly, it's difficult. I think one of the main things, and I think something that's really destroyed our village in some ways, is social media
Mm.
and I think that sense of competition of, oh God, it's like the FOMO of it all. It's really purposeful. It's a highlight reel. People aren't, I mean, some people I guess are going on there and crying, but most aren't. Most are just showing all the good parts. And though we love doing education there, and I've been doing that for a long time, I think we've already seen this in some data where participants were paid to stop using TikTok and Instagram and these social media platforms, that their mental health significantly improved in terms of anxiety and depression just after a few days of not using it.
Wow.
So, if I can say what's one thing that can be helpful, that's like an intervention, which actually can be quite hard if that's where you get your news sources, if that's where you connect
Mm.
with friends. But I would challenge you to connect in other ways, in group chats, in person, because I think for the most part, you'll note that people are. Struggling in very similar ways, or even if they do have,
Mhm.
there's all their struggles there. So I think that this may have been easier before social media, though I do have to say there's something about social media with infertility warriors that has been really positive of coming out and showing, actually, I've had a grief experience or I've had loss.
Mm.
Um, but overall, I think, that's just one easy one. And the rest is kind of like think about how you'd want to be treated. And if you want to tell your friends, hey, here's what would be helpful to me. Actually,
Oh.
try not to problem solve, like, I just want listening, They
Mm,
don't tell me, like, "What about adoption? What about" sometimes we have
Mm,
to kind of
yeah.
yeah.
put those, breaks in place, and especially before I think a lot of what's dreaded, especially in a fertility journey, is I'm gonna see all of my family, and they're gonna
Mm,
ask me, "When's baby coming?" or "How's that fertility journey going?" And you can and I would say with you and your partner, if you have one, like, come up with a script and say, like, "Here's what we're gonna say. Thank you so much for asking, but we kind of wanna, take a little break from talking about that this season or, like, at
mm,
this party." And I think, those kinds of interventions can be really, really helpful, though a lot of us are like, "Oh my god, that feels jarring to say." I think it's really protective.
yeah, protecting
Yeah.
your peace.
Yeah, I it's really interesting that you brought up social media because we have created a we have a pretty robust community on social media of people who do message us and say, "I've never been able to talk to anyone," or "I don't have anyone
I
who
know.
knows that I'm going through infertility or IVF," and it being a resource. But I think you're so right too that that is also like mixed into an algorithm and a feed where with things that might be difficult to digest, especially during the holiday season or winter months. I think I saw, correct me if I'm wrong, but you had a post about joining support groups
Yeah.
recently. And I
Yes.
think, yeah, can you talk a little bit about that or like how somebody could find a support group if they wanted
Yes.
one?
So we certainly have the same kind of double edge. I have a personal account that I've been doing for a very long time, and then Mavida has its own account. We have a wonderful community, and we get the best type of feedback. Of I've never had this sort of validation around my mental
Yeah.
health, and yet what's being fed is ever changing.
Mm.
I think you don't like. I don't know if you've had this experience. I don't see accounts that I follow anymore. I'm like, oh,
Oh, yeah.
who knows who
Yeah.
I was getting all these new things. So I think there's just so much mix and I think so much of it feels out of our control. And I think it's important for us as users to start to kind of band together and figure, actually, this is a tool that we use. So how can we you know, vote with not being here or not being as present here? In
Mm,
terms of support, and it's hard because this is where we like hear each other, LinkedIn or when like it's all these social media platforms, which is really challenging. That's why I love the podcast format.
Yeah.
So that's also kind of in a similar spot. But I think support groups is something we've been really interested in because we want to bring every member that we treat at Mavita should have a community. And even in we have a sort of part of our app that has all chats. And unlike WhatsApp or, Facebook, it's moderated by experts. So it's not going to go totally off the rails and misinformation, which is something that just happens everywhere. And what we think is like we want to bring the village back. And how do we do that? By pairing people who have similar concerns,
mm,
by pairing people and saying, like, here's everyone that's in Southern California, like, if you guys are interested in meeting. And support group is really interesting. That's non therapy. So it's not a clinical group, but it's just simply a place for people to come who are maybe have a shared issue, like infertility, for example. We do those. We did one actually around Black Friday. How you can kind of.
Cool.
We had
oh,
it was a lovely group where we talked to people about and their experiences with like having to meet up with family and how to avoid
mm,
consumerism when they didn't want to shop and were sort of feeling like that was a way to dissociate from things and mental health issues or concerns they were having. So I think that one was really productive. So we do these selectively, but also if there's enough of a need or a desire, we do them for all sorts of issues. And then in Mavida Health, we also have group therapy, which actually is a therapy group on all sorts of things, including infertility, postpartum, perimenopause, as well as individual therapy, group couples therapy, which is so important during this time. I
wow.
think people forget the importance of, especially when two people are trying to conceive and prescribing, which I think is another part that sometimes is stigmatized, but can be another helpful tool when you're having a lot of difficulties in the trying to conceive, pregnancy, postpartum, etc.
Wow. I love that you're bringing folks together, like, in real life. It's
Hmm.
still maybe via digital,
Yes. And like,
connection,
right,
but
exactly.
yeah, but with that added human touch, especially what you said about, kind of misinformation and a moderator approach and just additional tooling there that it's much more you're absolutely right. Like I don't what do you see on social anymore? I mean, we get a lot of laughs from there, but also yeah, you're not
Yeah,
as
not
connected as we think we are, right?
right, exactly. You're not seeing just your best friends there. And I think people sometimes still cling on to the idea, well, this is how I see all the updates from like my acquaintances and people I went to college with. But like I don't really think we're seeing any of
Yeah.
that anymore. And we've always believed we're fully digital because that just meets moms, especially or those that are
Yeah.
trying to conceive where they're at. You already have a million appointments during a cycle. The last thing we want to do is add something on that's
Mhm.
geographically difficult to get to. So virtual has always been really important to us, but because Amy, that's exactly what you pointed towards. Like we've partnered with big like Bobby or Coterie or sort of
Oh.
fertility clinics because we want to meet our members and we
Mhm.
love kind of doing in real life events because we're like we're real, we're here, and then we can support
Yeah.
you virtually when you're at in the comfort and convenience of your home.
Mhm. I love that. You're making me wanna I will be checking you out
Great, I'm
for
excited.
my own support. Can we talk, at the top of this, you mentioned the impact of hormones that the impact that hormones have on your mental health. Can we just talk real quick about estrogen? No, we can talk about any of the hormones, but on this podcast, I have shared many, many times when I go through any kind of, um, IVF cycle, or I've done many surgeries where estrogen therapy is part of the, post surgery recovery. Um, it just destroys me, and I want to know more about destroys my mental health specifically, like
That's
deep
interesting.
dark chasm.
Yeah.
Dive into it, you can't find your way out of it.
Yeah.
And I just want to understand a little bit more, what are we talking about when we talk about the hormones have this impact on your mental health? And that I also want validation that I'm not crazy, that
You're
it is
not. That's
actually
the
like
first
a
part.
real thing.
You're yeah, it's a real thing. I think what's really nuanced about this is, well, first, let's talk about estrogen. It's everywhere. It's in your brain. It's every place. So it's so interconnected in so many bodily functions. But I think what's really important to reiterate is it's in your brain and it's part of how
Mm.
we create serotonin and all these other neurotransmitters that are so important to mood regulation. So I think what is really difficult is it's two people can have estrogen treatment and one can be like you who has a horrible experience and the other one just goes about their business like there's no problem. And
Or
I
you're
think that
Katie, and then you go to the
I
gym and you feel
it
like
yeah.
no big deal.
superhero.
Yeah,
I
exactly. So I think what we then say is like, "Oh, well, that must be all in Amy's head because clearly like
Mhm.
it's not happening." But what we need to start to and how we understand in the field is that some people are just exquisitely sensitive to big changes in hormones.
Mm.
Sometimes we start to see it with like premenstrual dysphoric issues where they have more PMS symptoms, they have more kind of mood issues, maybe in their cycle. This is typically who doesn't do as well with the infertility or fertility process, and then has more challenges potentially during pregnancy and the postpartum. But it's not the absolute number. So people are obsessed with, oh, they can test my hormones. I need to test my hormones. Well, actually, it
Mm.
doesn't matter what the estrogen level is. For you, Amy, it's
Wow.
Mm.
probably the addition of more than your baseline is what gets you. And so that sort of the change for you, the delta is the issue. It's not
Mm.
the absolute number. And I think that's where some of the misinformation or misunderstanding is. And this is where I feel kind of sad about these predatory kind of hormone health companies that are like, go test your
Mm.
hormones and see how your hormones are doing when actually that's not the case. It's more based on medical history and how do you feel when you go on this type of estrogen. And for some people, it's sometimes isolated to systemic estrogen, and you may be fine with, a vaginal ring or an IUD may not be different, may be
Yeah.
different because it's progesterone. So I think
Mm.
there's a lot of variation and nuance, and that's why there's a whole field dedicated to it. But you're not crazy. Estrogen has a lot of effects. And when you
Yeah.
start changing it, whether it's endogenous, so it happens in your body because of a pregnancy, for example, or because it happens because of exogenous, so you put a patch on or you take a pill,
Mhm.
can be some significant effects. And for some people, it's as serious as people become severely depressed and suicidal.
Mm.
Mhm.
Wow.
Why don't we talk about this? I mean, you've been through IVF,
Yeah.
so you have done stims, and I don't feel like this is something. I feel like it's, one of those things where you get the pamphlet of like, here are the potential side effects, but it's not really something that is talked about, specifically with IVF clinics. And so, yeah, I guess, like, why don't we talk about it more, and how can somebody who's just starting IVF prepare themselves for like you said, like, everybody's gonna respond completely different,
Yes.
so we can't really say, like, how you're gonna
And
respond
and
to
it
it, but
can be and it can be certain things. For some people, like, it's totally fine, and then for some reason, they have to go on Lupron, and then all bets are
Mhm.
off.
Ooh,
Right?
Yeah.
Like, it's just right? It's just and that's like, you're getting into a perimenopausal state. So, it's
Mhm.
really, I think it's really varied. Why it doesn't matter is something I've been trying to, be a
It's the
proponent
question.
of, like, yeah, this
Yeah.
matters. I think IVF clinics, and I don't know the type you went to, mine was not a boutique, it was like,
Mhm.
bunch of people. We were all numbers, like
Yeah.
barely human beings.
Yeah.
So I think it's sort of like there's a mass kind of it's almost like a Costco, you know? There
Mm.
isn't like
Yeah.
specialized, "Hey, how are you doing? How is this feeling?" Again, there's some exceptional clinicians out there that try to have really good bedside manner, but I think the level of volume that they operate at makes it difficult. There's no one saying, "Hey, you should ask these questions."
Yeah.
I've heard so many stories of women coming to me where they're breaking down, sobbing, crying, and the IVF doctor's like, "Should I come back in 5 minutes?" Right? It's not like,
Wow.
"Hey,
Yeah.
can we talk about this? I just gave you really difficult news about an
Yeah.
AMH or something, or about the how many eggs got to the end of it having," and
Yeah.
it's like I think there's a missing human element of, like, you just told this person that this was the last egg retrieval they had and none were viable.
Mm.
Just,
Yeah.
like, sit down for 5 minutes and, like, have a conversation about this. This is, like, potentially some of the most devastating news this person just heard. And so a couple
Mm.
of things that I've been advocating for. So the pain, and you all have probably talked about this, of these type of diagnoses can be as
Mhm.
significant as an oncological diagnosis, so as being diagnosed with a cancer. That's how painful psychologically it is. And
Wow.
yet, the person on the other side, the doctor on the other side, doesn't necessarily behave in that way. So I think
Mhm.
there's certainly training that can be done to improve that, and including like the support nurses, et cetera. I think there should be like a social worker embedded in
Yeah.
every IVF clinic,
Oh
frankly.
my gosh,
Um,
yes.
because like if you don't have, and I get it, if you don't have time because of the volume, at least send someone who does have the time to be able to get that person into the care that they need. And I think the short-sighted part, well, there's a couple of parts. The rates of depression and anxiety in couples that are receiving assisted fertility is sky high. It's
Really.
like in some of the data it's like 50%, but I really do think it's more like 75, 80%. Most
Wow.
couples are going to have some kind of struggle, and you have all been through it. I've been through it. It's really challenging, and it can be a lot in terms of the mental load, and then how you relate to your partner who isn't necessarily going through all these things. And I think
Yeah.
both couples can be affected, especially when you're getting these really difficult diagnoses that are sometimes like, we don't know. Yeah,
Mm.
Yeah.
we're not sure.
Mhm.
Right.
Yep.
And there's just like no, okay, so what can we do? What's the end? When is this going to resolve? And there's so much uncertainty to it. We're going to do another
Mm.
cycle, but I don't know if you're going to end up having a live birth from this. There's no
Yeah.
guarantees. So all of those things are really impactful. But ultimately, why I think it's really short sighted economically is because these clinics, how do they do best is when they have live births. And we
Mm.
know that depression and anxiety, we're not sure exactly how the cycle goes, but if those are well treated, I think
Mm.
hopefully data will prove out that you can actually probably get better outcomes. In
Yeah.
addition to just having people call less, in a less anxious way, anxiety can
Yeah.
sometimes feel so
Mm.
much like ADHD or like you have attentional difficulties. And so those are the patients that are like, wait, you guys told me and you wrote down that my trigger shot was at 12, but is it at 12:01 or is it at 12:02? And what if I do it at 12:05? And these are like constant calls. And I'm like, don't you guys want these patients to have help
Right.
so you don't have to like
Right.
Yeah.
continue with this?
Right.
And so I think in some ways it's short sighted because I actually think better mental health could mean better outcomes in terms of
Mm.
fertility.
Yeah. They could be
That's so
a
interesting.
flywheel, right? Like, it could just work in
Mhm.
conjunction with each other, but we just don't
We
treat
don't
it
do
like
that.
that.
We know, like, the brain is not severed from, like, the
No.
Right.
reproductive organs. Like, yes, you're telling me I have, like, one egg left. Are you kidding? Like, that's going to affect what comes next. And we understand. And listen, the counter argument is that people have babies in war and in famine, and that,
Yeah,
like, your
sure.
body's stress level. But I just think that there's so much that we can do here to, like, decrease the cortisol, decrease those stress levels. And I really do think, obviously, we don't have enough women's health research. My hope
Mm.
is that Mavida Health will be part of this, but we hope to one day prove when you have these earlier interventions, we already are starting to see it in pregnancy. You have
Mhm.
pregnancy and postpartum mental health issues are the number one complication of childbirth. And so
Yeah.
when you have good mental health in the pregnancy, you have less chance of preterm delivery, of C-section, of NICU stays. And I think we could probably apply the same things to the fertility process.
Wow.
Yeah, well, and that's so interesting to note too because it's a the pregnancy comes after the fertility journey, right? So like
Mm.
ensuring that there is good mental health and positive mental
Foundation.
health throughout IVF and infertility is going to because, I in my first trimester, I was an anxious mess. Like it
Of
just
course.
the mental health challenges I experienced in pregnancy were so different, but also just so
Mm.
much more challenging than some of
Oh,
the ones I experienced during IVF. And like your clinic, I mean, you've like they literally call it
Mm.
graduation,
I
right?
know.
Like they are celebrating and sending you
I know.
off to then go see your high
and then you're
risk
like,
doctor every week for the
right. And I
Yeah.
think that the issue with so I always tell all of my pregnant patients who have gone through IVF, like, your pregnancy
Yeah.
didn't start now. You've been pregnant for 3
Mm,
years. So,
Yes.
yeah.
like, this is a really long kind of marathon. And of course, you want support in that time. But also, it's important when you've used assisted reproductive technologies, you are at a higher risk, both for pregnancy related mood issues and anxiety, but also for postpartum depression and
Mm.
anxiety. And I think that vulnerability is sometimes overlooked, in addition to, there are some more complications that can come with IVF pregnancies. So, like, is it irrational to
Mhm.
be worried? Like, yes and no. Like, if there are
Yeah.
some challenges, this was really
Mm,
hard. This may be your only shot, or you maybe have two more embryos and that's it. And, like, what if the stakes are just so high?
Yeah.
yeah.
And when there's no outlet for that, um, it's really hard on people.
Mhm. I just took a huge sigh, like, breath when you said that your pregnancy started years ago.
Yes.
Mm,
I
It's
think
just
I
hits.
mean, to me, pregnancy starts when you decide that you are open
Oof.
to motherhood. To
Mm.
me, that's it. When you freeze your eggs, even if you're gonna wait, like, to me,
Mm.
motherhood journey has already started.
Wow. Yes. I thank you for saying that. I think it's
yeah.
something we certainly feel, we've been when you're just those years just feel sort of like invisible as a part of the journey, and something Katie and I talk about a lot too, like as you went through pregnancy, Katie, right? Like it just sort of switches, and then now you're not the person who went through years of IVF and infertility. Now you're the pregnant person, and then you have the baby, and now you're the mom. You kind of forget all
Mhm.
of, or society, or sort of like our system
Everyone
sort
else
of
forgets. Yeah.
everyone else forgets, and you're like, should I forget too? Like, am I over
Yeah.
that? You
Yeah.
know? Do you ever really get over it? And what is it like to integrate it actually into your
Mm,
overall experience?
yeah.
I'm curious, Dr. Oreck, something we wanted to touch on too is around grief. And I think it relates really nicely into this part of the conversation about like motherhood sort of starts much earlier than the pregnancy itself, and certainly before the baby's actually here. But folks who go through an infertility journey, grief is sort of synonymous with infertility in that there's a loss. There's likely a lot of loss,
Yes.
and
And a
loss
loss of,
of
like, what your expectations were, of what the dreams and visions were of, like, even the fantasy of spontaneously conceiving at home
yeah.
after, like,
Mhm.
romantic sex. That's one that we always talk about, with patients. I certainly felt that in my, 3rd and 4th pregnancies that were actually IVF, but I lost my 3rd. And I
Mm,
think one thing to touch on that in sort of the forgetting about that and the experience is I
mm,
remember how, and listen, mine was kind of during the pandemic, so it was a little bit like people were in masks and kind of keeping their distance from each other a little bit, but it
Mm.
also felt like it was such a secret thing to, like, when you're in the waiting room, like, no one wants to hear anyone else's name and everyone wants to, like, keep to themselves. I
yeah.
remember when I ran into a friend from high school that at first it was like the sinking feeling, and then it was like, "Oh my god, this is the best thing that's happened, that I get to, like,
Oh,
actually talk to this person,
Mm.
and this doesn't feel like such a, secret mission that I'm going on and kind of hiding from everyone, but like somewhere where I can connect with this person that I've known for a long time." But I do
Mm.
think that's part of it. There's a hiding. There aren't many people that do like, and because there's so much superstition and concern of like a transfer party, or
Yeah.
like, let's
yeah.
count down how many eggs are viable. Like, there's no
Yeah.
celebration or joy around that because and listen, I don't know if I could do it.
Yeah.
Like, it's like you're holding your breath for, like, the phone call, and I've had some ones where it was like, "There's no viable eggs. Okay, bye." Like,
Yeah.
"Wait, what? Would you just, like, but can you
I've had emails. I've had
no."
emails of no
Yeah.
At least I
viable.
had a phone call, but it was like she could not get off the phone faster, and I'm like,
Yeah.
"Are you joking?" Like,
And
Oh
what's
my gosh.
next?
right,
And
like, we
and
just
and
forget
and
the investment financially, like, my life has been on hold, I've been to appointments every other day, and this is how you tell me? I mean, an email is just too much. It's
yeah.
like
Oh
that
my
you
god.
don't break up with someone like that, come on.
On a
Yeah.
on a Saturday, no less, like
Yeah.
But
Yeah.
it's like,
so,
I think we're
anyway.
so afraid of, like, a bad outcome that we
Mhm.
forget to, like, tap our supports and our village, where, like,
Mhm.
having people rooting for you, even if it's not a good outcome, can be so, so
Mhm.
powerful and to
I
hold
love
you, and
that.
I just felt so alone and isolated. And so you were asking about grief. It's like, yes, grief is all over that, and I'm kind of questioning, like, can we honor the process in a way so we can hold the grief, but there can also be, like, some wins or some celebrations?
Love that. I love that idea, and I think you're calling into question the stigma. Why is that stigma there? Who does it serve? Certainly not
Mm.
us.
And it's
Um,
so common now. Like,
yeah.
we can talk a lot about, like, what environmental factors may be at play here, but it's
Mm.
certainly not just everyone's body is somehow not working in the way that it should. I'm seeing women in their late 20s need IVF. Like, it is
Yeah.
just another kind of thing, and I do think that there is a time to just be like, this is in some ways routine at this point, and why are
Yeah.
we treating it as anything other than?
Yeah. I wanted to ask quickly on that note too. Is it so I feel like when you're going through an IVF journey, you just have to kind of keep going, right? Cuz the only person who's going to get you to the end is really yourself, right? If you don't push through.
Yeah.
But in that regard, I feel personally like I have not really stopped to grieve much more than like one day I'm very sad, next day, okay, call the clinic
Oh,
again,
same.
get
Yeah.
get right back on that horse. I think the real downtime I felt was in a loss, but certainly with like all the news and the negative
Oh,
results or the bad, detrimental or disastrous results that
yes.
you don't really pause there. Is that like, maybe a good thing because it keeps you going? Is it a
I
detrimental
know.
thing that we should actually pause? What are your
I'm of two minds of it, just like I am when someone has a loss and they decide that they're gonna get pregnant the next cycle, like, that
Mm,
works for you, that's great, but if you feel like you need to take a year off, that's fine. I think people grieve differently. I think
mm,
there's something biological to what you're saying, Amy, where it's like, okay, all the pain, and then, like, I'm just gonna go on. I think that there's something kind of that biology drives to kind of try to get
mm,
this outcome, frankly, but I do think there's a really powerful, and maybe this is like a whole other episode,
mm,
of loss and when you decide, I'm out, I'm
mhm,
tapped out. My body has been through enough, whether it's like an age, whether it's a number of cycles, whether it's financially or insurance driven. Like for me, it was going to be as much as my insurance would like give us some out of network cost. That was like that's it. Um,
mhm,
and you can use whatever artificial bounds it is, but it was really nice for me to know, like, okay, here's this line in the sand where, like, I tried everything I could, and here's where we are, and we can make other decisions or kind of move forward. And I think there is something to be called into question around what it's like to potentially not have children or have children by different means. I think people are too quick to offer solutions. And they're like, oh, it didn't work. Well, why don't you adopt? And it's like, do you know anything about adoption and how hard that is? Or why don't you use an egg donor? And it's like a lot of the amount of grief also that comes with that. Or they're like, "We use a surrogate." I'm like, it's not that easy and it's expensive
yeah,
and there's a huge there's a huge, like, I think, that people don't even think about when they just use a surrogate of like, that is a huge burden, not only on yourself, on your it's taxing to have someone you don't know carry your child. I mean, apart from the financial costs, etc. So I do think that there is a conversation, and I think Jennifer Aniston started to talk about it in a way that I hadn't heard before, which was a really nice beginning to the dialogue of like, yes, it's something I imagine that she really wanted. And I think she expresses that in how you come to the end of things. And I think in general, our culture has a hard time with ending and loss.
yes. Well, that
Whew.
can you come back? I would love to talk about that. So I'm on a surrogacy journey now, and I can tell you how that took a really lot of effort, lot of work to get to,
Yeah.
uh, a place where I'm okay with that and
I
excited
mean, it
about it
wasn't
now.
just like, I'm gonna get a surrogate. It's
Well,
like going out and
and
buying a
now
new handbag. Like it's just
and
it's funny how people say that of like, well, here,
yeah.
I've solved your problem.
Yeah, and now, we're over 9 months into that journey, and we're not close yet.
Uh-huh.
So, yes, let's put it in perspective. But I have been very curious, and I think both Katie and I are curious about how you start to get to a point where you can make a different decision,
Yeah.
whatever that
Mhm.
decision is. So, I'd love to actually have a chat on that
Oh, of
specifically.
course.
What are some ways to actually move through the decision making process and get to a place where you kind of get unstuck?
Well, and always with this, because I think what you're describing, Amy, is like you kind of get on this hamster wheel and you're kind of like, well, I imagine everyone's doing this. And we just keep going and going.
Mhm.
And
Oh,
just says,
yeah.
let's try it again. And I think
12
ultimately,
surgeries later.
and ultimately, what I start to tell people is like, and this is where therapy is really nice because it gives you the space to be like, can I back up from this for a second and kind of think about what my
Mm,
values are? Is this
mm,
Mm.
aligned with how I want to live? Is this what I want? Is family or is having biological children like so high on the list? And you start to like rearrange those values, what's important to you. And I think it can change. Might be very
mm,
different who you were at 20, who you are now. But I think that is important. And I think there's a conversation that unfortunately with like our political situation is going in the wrong direction of
yeah.
like women have value outside of their reproductive organs
Mm. Say
and
it
their
louder.
yeah, or their reproductive capability. Like,
Right.
there can be a life without children where you're not an old crone. You may be a very successful person that is maternal in other ways. I think that's my other thing of like, you don't have to be a biological mother to be maternal. Um,
Mm.
Mm.
so many ways to have that and experience that. I did this before ever being a mother. And what was so funny is that so many of my patients be like, "Wait, you're not a mom?" You're like, "I'm not a mom, but I can
Oh.
you through, right, the fertility journey, through all of this," even though at that point I wasn't sure if I wanted kids or not.
Mm.
So I think that it's almost like on a societal level, we also have to decide like where is our value and can we have value outside of this and how does that work and is there a life that's valuable and it might not be for everyone but where children don't have to be a part of it to have a meaningful existence.
Yeah.
That's so
Uh,
good.
it's such an important conversation.
Oh.
Well, to wrap us up, let's end with maybe one rapid fire thing
I
that
was gonna
you
ask
would.
the
Yeah,
one
you go.
I want
You go.
I wanna know the one, how do you personally stay grounded? So, like, what are
Oh.
your top tips for navigating hormonal fluctuations?
Oh god, that one's hard. I think movement is one of my biggest ones.
Yes.
I think moving
Yeah.
your body, it gets you so present in your body. And the other one that I sometimes fall off the wagon on is a meditation practice. I try to tell people it
Mm.
doesn't have to be really complex. It can be as simple as like just being present for a second while you're brushing your teeth. And also
Oh.
kind of trying to get the phones away when you're with your partner, when you're with your friends, when you're with your loved ones, your kids, whatever it is, so you can
Yeah.
really be together in a room, not, "Hey guys, what's up?" That's not
Mm,
Yeah.
connecting. So
yeah.
I'm almost like, let's get rid of these things
Yeah. I
Hey,
love that.
I'm with you.
because I
That's
need to go
such good
back to like a,
advice.
a flip phone. I asked
Yeah.
my husband, do those exist anymore?
I know. I agree.
People are going back to, people are installing home phones again, which is really interesting. So who
Yeah.
knows?
I
You
think I
never
might
know.
be up for that. But then remembering
Well,
people's phone numbers.
Oh, yeah.
oh my
Remember
gosh,
how
no
hard
way.
that was?
It's gotta be like a
No.
flip. It's gotta be like a home phone that has, like, Alexa on it, so you're like,
Oh,
"Just
Yes,
dial
Alexa call.
Alexa,
fine,
call
fine,
Katie."
fine, fine. That's the compromise.
Compromise, yeah. Well, it was so incredible to talk to you, and we definitely have to have you back to dig into a couple more of these topics, and we just so appreciate that you hopped on,
Yeah.
especially, just we deeply feel that mental health is such an important part of what we're all going through, and then especially during this season, the
I
winter
know.
season, winter months as well. So thank you so much for taking the time, and this was so
Thank
great.
you so much. It was wonderful. I can't wait to do this again.
Yeah.
Please
Yes,
go ahead,
in
do it in person.
person, we'll
Yes,
have
yes.
Yes.
yes, it would
Would
be
love
great.
that. Thank you so much.
Awesome. All right.
Bye.
Thank
Thank
you.
you.
Bye.